My name is Russell, and I work at St. Francis Hospital as a full-time cook.
My name is Pam. I work at Abbott Northwestern in the Holter department.
My name is Jim Kepke. I work at United Hospital in the maintenance department.
I gave a presentation today on bereavement leave to make sure that people that lose a loved one, as far as a child or a spouse, that they have the opportunity to take a 6-week leave of absence without pay. I poured my heart out told them my story of the death of my son, and they came back to me and slapped me with a counter proposal, which I thought was offensive. Counter proposed to waive the union leave. So basically, so the union stewards cannot do any kind of union leave. So it's kind of slap in the face for myself.
I was insulted by management by the response to his story. There was zero heart coming from them.
So today I talked about nursing assistants, which is near and dear to my heart. We proposed that Allina across the board raise FTEs for nursing assistants. I told them the barriers for doing their jobs, ill calls that are not replaced, staffing grids that are outdated, high acuity patients, and their response to us was not to address any of the issues, but their response was that's up to Allina to decide how many FTEs they will add, if any.
Today I presented to them the need for increased staffing in the maintenance department. I explained to them the size of the campus since I started 25 years ago at United, how it was mainly 3 buildings and a couple parking ramps, to where we went to 6 or 7 buildings, 6-story buildings, an added parking ramp, and going from 20-some employees down to 8 employees. I don't know how they can justify the preventive maintenance and maintenance program that they run at United with what they're offering. And they said that they wouldn't be interested in hiring any more employees.
They don't have enough staff so that nursing assistants can take PTO a week from today. In 2014, Abbott alone had over 17,000 hours of overtime, but yet they don't need to add staff. They don't need to add FTEs so that we can take PTO. That astounds me. And that is just nursing. They are the face of Allina. We as SEIU members are the face of Allina. We're the ones that care for the patients. We're the ones that care for the facilities. We're the ones that have the compassion towards the patients. They don't. And yet they don't want to take any responsibility for fixing any of the issues. They tell us how we're supposed to do our job, but they don't do it. Our vice president, Liz Asmus, and Jamie Gelly, our president, should get a standing ovation. They actually told the lead negotiator for Allina to leave the room. Their behavior was so poor in responding to Russ's proposal for bereavement leave. I applaud them.